what I can do initially is just have her raise this leg up as high as you can. Down, bring the other one up. Difference? Is there a difference?
Left side is more painful.
There's pain when you raise the left one. Where's the pain?
Here. Oh, there's. All the way down here.
All the way through there. And usually what I'll ask the patient, where do you feel it? High, middle, or low? Okay, for her, it's kind of raining through, but it's all left side for her. And as you saw, that left leg did not come up as high as the right. Okay, raise that leg up again. I'm going to stabilize on the opposite SI joint. That's painful to raise it. Is that painful to raise it? Okay, hold that up there. Keep it up there. Keep it up there. Hold up there. Hold, resist. Hold, resist. Okay, bring the other one up. Hold, resist, hold. We got dysfunction with that one. When I tested that one, what did you feel?
Left SI.
Okay.
And
So-
then I just kind of gave out.
Yeah. So there's a lot of issues. She's got low back. We looked at the obliques on her already. They were a little dysfunctional. We worked on the QL. There's been some there, but that's setting all this up just to fail and be weak. So going after those obliques again from the backside, I can come up under the ribs, and they're really sensitive there. So I want to just touch and hold, real light and gentle, let it calm down. By the way, this is your homework. These ribs right here need to be held upward to allow those oblique muscles time to relax. Feels kind of good. Stop in about an hour, right? Good. And then I can squeeze through the obliques from here as well, nice and tender. This is chronic. By the way, this is not an acute muscle tension, this is chronic. Can you feel the difference in it? It's not got that sharpness to it, it's got that dull, achy hardness to it. And then into the pelvic rim again, a little farther back on her because she's now face down. I can get in through here more. Brace that again. Hold, resist. Any difference?
I have more strength.
Yeah, there was a little bit better there. So then I'm going to go after her glute. So I'm going to start at the SI joint, and I'm going to walk right across under the rim of the pelvis where the gluteus maximus inserts along that border. It's a little tender there, yeah?
Yeah, but it feels good.
And if I keep going lateral, I'll start hitting glute medius, which she may have some issues there, so I'm going to do a little more out there, and there's the glute medius, all kicking in. By the way, glute medius fibers go to the top of the femur head, so I can come to the top of this femur head, and I can push that inferior. I can use a nice soft part of my hand to do that because it's sensitive for her, and that feels kind of good.
It hurts in a good way.
Hurts so good. Yeah, right there. And then coming back to the glute maximus, coming from the SI joint, I can then walk down the sacrum, looking for what's tender through there. And that's all a little sensitive, yeah? And then I can take this SI joint and just compress with a little medial to lateral. That feels good.
Yeah, it does.
I'll stay there for a while too. And then these fibers coming down into the back of her femur and into the iliotibial band. So iliotibial band issues laterally, glute can be a big effect on that as well. So I'm going to find where they insert here, and it's tender. And since that's so tender, I'm just going to use a soft part of my hand. And so as I'm keeping pressure through the SI joint, which feels good, I'm now going to come over here and work these insert fibers and look for the heel to do a little rotation, knowing that I'm getting that whole femur head to rotate. Feels good? Raise that again. Hold, resist. And now she's got more power, and it came way up high that time. Did you see that? How did that feel?
Better.
Yeah. There's still some dysfunction going on here. So I'm going to go through these glute muscles, and I can pinch them. And so when I come across this top zone, pinching here first, tender. Okay. And then I can take that down a little bit here. Yeah, really tender. And then as I get down, even with the ischium bone, I'm going to change my angle of grabbing those fibers because they're now running this way a little more. And so I can grab through that, and that's not as tender as the other stuff. Okay, so mostly we want to come in and grab this stuff that's right in there. Okay, and then I can tell the patient, your homework is to go in and grab your butt cheek. Okay,
Well, we're told not to do work, right?
thank you. Might be some medico-legal aspect
Yeah.
or something like that. And that one's pretty tender too. And right at the femur head for that glute medius. By the way, we didn't talk a lot about glute medius, but one of the things you can do, real quick evaluation, is you can just have the person take their hip, shift it out to the side, and take that hip and push it back into that corner.
Yep.
And you'll be coming right up through there, and then you can have them compare and check the other one. By the way, that's also their homework. That's their stretch to unlock it. Tender. You're all beat up. Good. Raise that leg again. Hold, resist. Definitely more strength. Yay. Going on to the piriformis, I'm going to take the leg and put it in the back of the other knee. I'm going to stabilize on the opposite side of the sacrum as I bring this leg over. Hold, resist, resist. And that was one finger. Down you go. Bring that one up in the back of this knee. Hold there, hold, resist. Also really weak. Down you go. Coming into that piriform, or the piriformis, I'm going to come to the sacrum. I'm going to come to the right to the side of the sacrum bone and then drop underneath it. So I'm going to just find the lateral border of her sacrum, and then I'm going to come and go right under, and I'm trying to scoop up and in. And it's very tender on her. This is actually more tender than other stuff.
Yeah, it's pretty sore.
And they were very, very weak. They were both ones.
Mhm.
So you definitely have more piriformis issue going on than other stuff down in here. And it's painful. And this is more acute pain versus chronic pain. It's more sharp, isn't it?
Mhm.
We can hear the agony.
Yeah, right?
Yeah.
And I'm being nice. Yeah. Feels good?
In a good way.
Thank you. And then I'm going to come get her other one too while we're at it. Coming in, scooping right up under that lateral aspect of her sacrum. Yeah. And because this is so acute on her, remember with acute pain, we're just going to touch and hold. It's going to be way more tolerant for the patient. I want the patient to breathe through and release that tension. When they can take a deep breath in and relax, I know we've made some really good progress. And then we're going to go out to that femur head again, find where it's really tender, and because it's so sensitive, I'm going to just hold pressure there. Now what I can do, because she's got bilaterals, I'm going to go to both femur heads. I'm going to take both those femur heads and I'm going to rotate them open at the same time, so both heels should be rotating. They go in here. And that feels good. And I should stay here for about an hour or two, right?
Uh-huh.
Uh-huh. And so just holding in here, I can do a little wiggle side to side. And that feels really nice, yeah?
Yep. Not near as painful as the other.
Thank you. Drop that in the back of that knee over there, hold, resist. Better, down. This one over here, hold there, hold, and down. These are both just really, really torn. By the way, when we did that, where do you feel the discomfort? Is it all here in the
Part of the sacrum, yeah. And not as sore this time around.
Bring that